Very good evening, friends. Meeting again in the session of Stuart Close philosophy, and we're discussing regarding the symptomatology. Symptomatology is the big chapter where he tried to explain the importance of varieties of symptoms. Varieties of symptoms he has tried to explain over there. He has started with the first, what is symptom, then the definition of a symptom, that it is an expression of the internal disease in the form of some manifestation is called as a symptom. And then he classified symptoms into two types, the subjective and objective, and explaining the details about the subjective and objective, the more importance of subjective in homeopathic practice as they individualize the case. After explaining that, he has started explaining about the totality of the symptoms and the thorough aspect of and importance of totality of symptoms he tried to explain over there. He has tried to explain Hahnemannian definition of totality of symptoms in relation with the Kent's aspect of understanding it, at the same time Bonning-Hussein's aspect of understanding it. And he explained one important thing. Totality of symptoms means not only just numerical totality, but the totality of the symptoms should be based or it is made up of characteristic symptoms to individualize the case. And all those things which he explained over there, and thereafter he started explaining about the importance of characteristic symptoms and keynote. And while explaining the importance of characteristic symptoms, he explains that it is not a single symptom which defines the remedy. It is not, no one has said that a single keynote you prescribe the remedy. Ultimately, it is the whole totality you have to take into consideration, but your totality should be made up of such types of characteristic symptoms or keynotes. And this is what he was explaining. And while explaining that, he started explaining about the importance of Guernsey's keynotes as well as Adolphe Lippe's keynotes. Both of them have written very good books where it was very easy to differentiate one remedy from another remedy, because keynotes are the things which are differentiating factors. Keynotes are not only the things on the basis of which you prescribe the remedy, but keynotes are things on the basis of which you must differentiate one remedy from another remedy. And in the last paragraph, he has given the example of Dr. Lippett's case, as well as he has tried to explain the importance of Guernsey's prescribing. And what last sentence was there in on the page number 159, the third paragraph, where the last sentence was, Dr. Guernsey did not teach prescribing on a single symptom. And this is the truth. You should not prescribe on one symptom. Then you mislead. Then you cannot get the right remedy. If you want to get a right remedy, what is needed is the form base of totality. And that's why what he says over there, in the preface to the first edition of his great work on obstetrics, Dr. Guernsey presents the subject of keynote prescribing in another way. He says, the plan of treatment may seem to some rather novel and perhaps on its first view objectionable, in as much as it may seem like prescribing for a single symptom, whereas such is not the fact. It is not only meant to state some strong characteristic symptom, which will often be found the governing symptom, and on referring to the symptom in codex or materia medica, all the others will be there if this one is. So what he is explaining over there in the preface, he explains, Dr. Guernsey, that you should not prescribe only on one single keynote. Keynote is the guiding symptom with which you can reach to the remedy. But unless and until you confirm with the totality, you should not prescribe that remedy. It is the key to open the lock. It is the key to find it out, yes, what may be the possible remedy. You can go ahead with the help of that, because this is the only thing on the basis of which it is possible to open the lock of that specific chronic or acute case. And that's why he himself explained that you should not prescribe on single keynote. There must be a head to everything. So, in symptomatology, if the most interior or peculiar symptom or keynote is discernible, it will usually be found that all other symptoms of the case will also be found under that remedy, which produce that this peculiar one, if the remedy be well proven. He explains that if in your case, if you get a one characteristic symptom, strong characteristic symptom, peculiar symptom, and it is most inner core, which covers the most inner core of that human being. Maybe it may be related with the mind of that human being. And if that peculiarity is there in that specific symptom, then automatically rest of the symptoms definitely fall in the same remedy. This is because the inner core defines more specificity towards the remedy. And if you have a single characteristic which is related with the inner core of the human being, then rest of the most commonly the rest of the work is done. Your remedy will definitely show other symptoms in the patient which may be physical also. It will be necessary in order to prescribe efficiently to discover in every case that which characterizes one remedy above another in every combination of symptoms that exist. There is certainly that in every case of illness which preeminently characterizes that case or causes it to differ from every other. So, in the remedy to be selected, there is and must be peculiar combination of symptoms, a characteristic or keynote. So, what he is explaining, if you have the totality, you should have such types of combinations of characteristics, keynotes along with the other symptoms. And if it is there, then you are firm regarding the remedy. For example, a patient comes to you with a severe burning in palms, burning in soles, there is burning in head, all those things which you observe over there. And after getting that, you go on finding it out, the modalities, and patient says that I, I'm doctor, whenever burning is so severe, I used to bath with hot water. Then I feel relaxed. Then you go on taking the case, you get that patient is very much thirsty and he sips continuously a sips of water. Then you find it out that person is very anxious regarding his disorder, regarding his health. See, automatically rest of the things is are automatically gets collected, interconnected, and you get the arsenic as a remedy over there. This is interlinked. And that's why you always get that specific thing if you get the key. That because of key, it becomes rather simple to find it out, rest of the symptoms of the remedy in that case. Strike that, and all others are easily touched, attuned, or sounded. There is only one keynote to any piece of music, however complicated, and that note governs all others in the various parts, no matter how many variations, trills, and accompaniments, etc. So he gives very clear explanation of what is keynote. Keynote is the thing which denotes exactly what may be the possible remedy, and then it opens the door, and then you can go on connecting and collecting all symptoms of the case and which you can get in that specific remedy. It might be at the particular level you get those, and your totality becomes more and more confirmed regarding that remedy. And that is the importance of keynotes or characteristics in the case. And that's why Hahnemann himself in Aphorism 153 mentioned that in your case, there must be certain symptoms which are peculiar, singular, striking, which denotes directly towards the remedy. But you should not prescribe on only one symptom. That opens the lock and you confirm it with the rest of the symptoms. If it is understood that keynote to the case may and often does exist in are consistent, a peculiar combination, as Gunsey puts it, and that it is not merely some peculiar, single, possibly incomplete symptom, which the tyro is always mistakenly looking for. The subject is cleared of the part of its obscurity. Dr. Gunsey might have summed up the whole matter in one word: generalization, which has been discussed at length in chapters on the logic of homeopathy. So what he is explaining? He is explaining over there that importance of peculiar symptoms in your case, and if they are incomplete, you cannot reach to something. You might get one important thing. He has used the word generalization. Actually, generalization was the concept which was explained by Boningus. Whatever is true for the part is true for whole human being. That is what is Boningo's concept of generalization. So, if a person who is having burning in his palms, which is better by keeping it under the warm water, and person feels better, then if it has been happened to a particular part, still you can consider it as a applied to the person as a whole, and consider in that case burning is better by hot application. If you make it generalize and then find it out remedy and you get the answer, this is the arsenic album. This method is called as grand generalization. And that's why Boningusin's therapeutic pocketbook, which is so small, consists of 7 chapters only, because he has utilized this concept throughout his repertoire. And that's why it's a quick bedside prescriber. You can easily repertorize over there with that specific small book, Boningusin's therapeutic pocketbook, and that gives you a rather simple way of reaching to the remedy. So whatever is true for the part, you should generalize, make it generalize, repertorize it, and give the remedy to the patient. And this is his approach of grand generalization. Dr. Lippe, discussing characteristic symptoms, wrote as follows. When medicines are submitted to the provings upon the healthy, they develop variety of symptoms in variety of provers. Each prover has its own peculiar characteristic individuality, affected by the medicine in a peculiar manner. Other differently constituted individuals experience different, yet similar peculiar symptoms from the same medicine. There is a similarity and a difference evident upon close comparison. In like manner, diseases and all other external influences affect different individuals differently yet similarly. The physiological school and its followers accept in disease only what is general, common to all those affected by it. In medicinal proving, in the same manner, they accept only that which has been experienced alike by many. In both cases, they simply generalize. The homeopathic school reverses this order. Accepting all symptoms experienced by differently constituted provers, they considered as peculiarly characteristic individual symptoms of the patient, those not generally experienced by others suffering from similar form of disease. He has explained here, Dr. Lippe has explained about the differentiation of provings and understanding about the proving. In modern science, when they prove the drugs, they only finds it out what is common in them. Generally, they never proves it on healthy human beings. They prove it on animals, and they finds it out what tissue change it has made. Second important thing, they prove it in material doses or rather physiological doses. And that's why they used to collect whatever the common symptoms or common changes happens in tissue level that they notices, and that's what they consider says this is the action of the remedy. As opposite to this, when we prove homeopathically, we prove it on healthy human beings. That is the first difference. Second important difference is that we never prove it on in the physiological doses or material doses. We used to prove it in dynamic form, in the potentized form. Third important difference is that we used to recollect whatever the data is, we used to get it from different provers. We used to collect every prover's, all the things. We used to analyze what is common and gives them a certain marks. If there are symptoms which are proved by all the provers, then you give them a 3 marks symptoms. Those are grade 1 symptoms in your proving. There are certain group of symptoms which have been proved by 50% of provers. 50% never shows that. You write it in italics, gives them 2 marks, and they are grade 2 symptoms. And there are certain symptoms which are proved only by 1 or 2 provers, which you give 1 mark, they are grade 3 symptoms. But we used to take into consideration all of them. We never collect only the what is common to them. We used to take into consideration all of them, and according to the situation and according to the case, we used to utilize them. So 1 mark symptom is also important for us. At the same time, 3 mark symptom is also important for us. It means whether it might be a grade 1, grade 2, grade 3, all symptoms are necessary because they are the individualistic reactions to that specific stimulus. And there are n number of varieties of the peoples are present. Accordingly, we can get all those things in our patients, and those are in fact basic tools on the basis of which you are going to prescribe. So no symptom we omit. We used to write it down in our proving, and that is the big difference between the modern proving and homeopathic proving. Then he further says, this is individualizing with the vengeance. In asperizing the process of what he calls generalizing, Dr. Lippe reduces the very instrument he apparently unconsciously using but misusing the word. One is traditional, one is the traditional pathological diagnostic method based upon the arbitrary and artificial classification of only the common or gross phenomena of the disease. The other is the homeopathic natural or inductive method of modern science based upon all phenomena of the case, but paying particular attention to the uncommon and peculiar features, never forgetting that we always have the individual patient to treat and cure. So there is a big difference what Lippe says. We used to take into consideration 2 types of classification. Modern classification includes just a nomenclature. So if there are very specific symptoms, if there is sore throat, difficulty in swallowing, then there is a severe enlargement of the tonsils and patient is having fever, you label, yes, this patient is tonsillitis. But you cannot prescribe. Yes, you have labeled the disease, you have classified this is tonsillitis. But you cannot prescribe unless and until you individualize that. If the patient comes to you with severe sore throat, he cannot even take anything by mouth, whether liquids or solids. It is too painful, associated with very high grade fever. The face is absolutely flushed. The tonsils are completely inflamed, red, engorged, and he is not able to talk also. And he is having very severe headache, which is throbbing, and you observe there are throbbing carotids. Now you know, yes, this patient is of a belladonna because it expresses that individuality. So common symptoms of the disorder never gives you the remedy, but the peculiar characteristics are necessary to individualize that patient and find it out the remedy. From homeopathic point of view, such types of peculiar characteristic symptoms are necessary to find it out a remedy. From allopathic point of view, that it doesn't signify anything to them. So he differentiated the importance of characteristic symptoms for the homeopath. And then he took one more example. Dr. P.P. Wells, a well-known homeopath, says characteristic symptoms are those which individualize both the disease and the drug. That which distinguishes the individual case of the disease to be treated from other members of its class, to be find its resemblance among those effects of the drugs which distinguish it from other drugs. This is what we mean when we say that with this the law of cure has chiefly to do. When we say like cures like, this is the like which we mean. So he takes the example of Dr. P.P. Wells, and he has rightly said over there that these keynotes are very much necessary to differentiate one patient from another patient, even though they are suffering from the same type of disorder. Both patients who are having appendicitis, but both of them presents it in a different manner. One comes with very severe stitching pain, pressing hand over there on the right in the right iliac fossa, not wants to walk a certain distance, not wants to keep up, even make up one single footstep, and he lies in that specific position, lying on same side, with very much thirst, with constipation. And this is how we understand this. He is having the appendicitis, but his appendicitis is septitis is expressing as a remedy, because individuality is expressing there is a severe stitching type of pain. So you get a bryonia over there. But the second patient comes to you, and second patient where there is a where you can find it out that he is having very throbbing, pulsating pain. He is also having the flushed face. His pulse rate is increased. There is full bounding pulse. The patient is absolutely having very high grade fever and severe headache, the throbbing headache. And now it is differentiating. The symptoms are differentiating. Both of them have the appendicitis, but both of them are absolutely presenting a different entity. Our remedy depends upon those characteristic individualizing features with which we can find this. For second patient, it might be belladonna. For first patient, it might be bryony, because we get those characteristics. If we don't get those characteristics, it is rather difficult for us to reach to the right remedy. And this is what rightly said by Dr. P.P. Wells. We can differentiate the disease as well as drugs on the basis of characteristic symptoms. Characteristics may sometimes be symptoms observed only as the result of the closest scrutiny, like the apparently tripling clues in the mysterious murder case, which the ordinary detective overlooks or ignores, but which a Sherlock Holmes pounces upon and utilizes with amazing logical acumen to clear up what is otherwise impossible of the solution. Their value depends upon who is using them. So he is giving one more example. He is comparing how to hunt the remedy. As the Sherlock Holmes detective stories, if you have seen or read, how he used to find it out the thief, or how he used to find it out the robbers, was interesting. In the similar manner, we used to find it out the remedies. The method is similar. Unless we get some characteristics, some peculiar, some strange, some striking, we cannot find it out a remedy. Same is true with the Sherlock Holmes. An agassiz or lady placed in possession of fragment of bone and scale of fish found in the found in the remains of some preglacial geologic period will reconstruct for us not only the animal or fish from which it came, but unfold whole chapter of natural history, picture the scene, the ripple, a forgotten period of Earth's history before our delighted eyes. He is comparing it. What is the importance of it? If you get a single thing on the basis of which you can elaborate the picture, you can find it out the whole picture. And he has given is as compared to the an agassiz who used to give you a absolutely historical pictures of certain things. So to hunt for characteristic in a case is so much important, with which it is possible to come to the right remedy. And that's why the characteristic symptoms always plays very important role in finding it out a remedy, right remedy. Dr. Charles G. Rowe pointed out that scarcely one of the keynotes or characteristic symptoms belongs exclusively to a single remedy, and cautioned us not to diagnose a remedy one symptom only, be it ever so characteristic. So Dr. Charles Rowe also says you should not make a remedy, prescribe remedy on single characteristic, even though it is two characteristic. While in some cases, he says, it may point exactly to the remedy, it cannot do so in every case, as it is not rational to suppose that whole sphere of action of the remedy, which is often extensive and complex, should find its unerring expression and indication in one symptom. But such characteristics are of great aid in selection of the remedy, as they define the circle of remedies out of which we must select. So if we get in a case one strong characteristic, then we can unfold the case. That is the importance of characteristic symptom. They are not the symptoms with which you can reach directly to a remedy, but they unfold the case, and easily you can correlate rest of the symptoms with this keynote symptom, and then you can make whole totality leading toward that remedy, and you can prescribe for that patient. I think it's better to stop over here, and tomorrow we'll continue with the same thing. Uh, we are on concluding part of this big chapter of symptomatology. I think within 2-3 lectures we can finish that, and we used to learn a lot of things in this chapter, specifically the symptomatology. So that's all for today, and today evening at 8 o'clock we'll meet with the another remedy, that is the Berberis vulgaris. So we can learn a lot of clinical experiences on the Berberis vulgaris in today's session. Be there at 8 o'clock and learn the practical materia medica over there. So till that period, thanks a lot. If any query is there, yes, we can have a chat. Otherwise, we'll conclude. Any question?
Sir, recurrent urinary infection with
I
burning. Not hello, sir. Are you getting, sir?
no. What you are
Sir,
saying?
recurrent urine infection in
Huh?
female, sir.
Hmm.
Pain after maturation.
Hmm.
Only a few times, but it is not. I have given sarsaparilla and also cantharis, but not improving, sir. Earlier it was there more, but now it has been ameliorated, but not curing, sir.
It
So what
means
could be
that there
the
must
reason,
be
sir, and
some.
what could be the specific?
I'm not getting your voice
Yes,
clearly.
sir.
Basically, in such types of cases, you have
Yes,
to
sir.
find it out the same symptom properly. Open the repertories, find it out exactly the symptom. You must find it out in the chapter of urethra. Just open pain, what type of pain it is, that you have to find it out. And then you find it out aggravated after micturition. Hunt for the remedy on the basis of that specific peculiarity. You will get the answer for it. Sarsaparilla, we used to use it generally. It is generalized remedy. But you will not going to get cure unless and until you get the right remedy for the case. So my suggestion is that open the repertory, find it out exact rubric, exact type of symptom over there, exact sensation in the patient, and then repertorize.
Sir, yes, sir. Yes, sir. Sir, first I have given during menstruation there is a pain. I have given cantharis, and that symptom has improved.
Hmm.
After that, at the end of menstruation, urination, that time I have used sarsaparilla. But now, sir, after menstruation,
Okay,
that is
my
after
suggestion
urination.
is that to take the details about it and open the repertory and find it out. You will get the answer of it.
Okay, sir. Okay, sir. Thank you,
Yeah.
sir.
Okay. So thank you and good evening.